Hello all, this is Mrs.Lalithamani, Professor from SNS College of Nursing. In this lecture series, we are dealing about the important topics so that we can have a cross or quick reference so that it will be helpful for us to remember for a longer duration of time. So in this lecture series, we are going to deal about the adult health nursing topic. That system includes the circulatory system, where we will be having a brushing up of our memory about the structure of the heart. So when we talk about the case scenario, while coming on to a case scenario where if I am asking a question to you that, can you describe your home? The very first thing you will tell me, there are 5 rooms in my home and there are 2 gates, a big gate, this yellow color painted house, and there are plenty of trees, plants present. So all these are the describing nature about your residence. So when I ask about, can you explain about the heart? There you will be knowing about, yes, the heart is a hollow structural organ. It has a capacity, the length, width, breadth, everything is that. So you will be able to tell something how it is. But when we compare and contrast, for example, if you think that a house has many rooms and all these rooms are being divided with some structures, walls, and some rooms have connectivity to the other room, and there are 2 entrances being present in the home where you can enter in one way and you can go into the another way. So like that we need to compare and study. While I tell the home structure, you imagine that you are in your home and you will start explaining. Likewise, we need to have a memory that how the chambers of the heart are being present or how the structure of the heart is. So coming on to the structures, the chambers of the heart or the structure, internal structure, we can see that there are 2 upper chambers and 2 lower chambers. The upper chambers are being called as the atria and the lower chambers are called as the ventricles. So that there are 2 upper chambers, one is the right ventricle and the left ventricle. There are upper chambers will be called as right atrium and left atrium. Lower chambers are called as ventricles. So how it is being divided? All these 4 chambers, we got now 4 chambers. So how these 4 are being divided? The 2 atrium which are being present as the upper chambers are divided by interatrial septum, and the 2 ventricles which are being present in the right side and the left side are divided with the interventricular septum. So it is like a wall which will be separating the chambers. So there are 2 upper chambers, right atrium and left atrium, 2 lower chambers, left ventricle and right ventricle. The septum, there is an interatrial septum and interventricular septum. So while we talk about this one, we need to think about the blood flow or the blood circulation. The heart is being concerned with the right side and the left side. So the right side we have right atrium and right ventricle. The left side we have the left atrium and the left ventricle. So when we think both these right and left chambers, there are now 4 chambers. These are being divided horizontally and also vertically. So the horizontally will be atrioventricular septum. Vertically will be 2 septum. One is interatrial septum and another one is interventricular septum. So the horizontal septum will be atrioventricular septum. The upper part is atrium and the lower part is the ventricle. So in between the septum or the wall is upper and lower will be called as atrioventricular septum. The vertical partition will be interatrial septum in between 2 atrium and interventricular septum between the 2 ventricles. So we are now having 4 chambers, 2 vertical septums and 1 horizontal septum, maybe in the right side and also in the left side. So coming on to the chambers of the heart, we have the right atrium, right ventricle dealing with the impure blood, and the left atrium and the left ventricle dealing with the pure blood. So the right atrium will be receiving blood from the upper part of the body and the lower part of the body through the superior vena cava and inferior vena cava. It will be reaching to the right ventricle. So the right ventricle will be collecting blood from the right atrium and it will be sending this blood to the lungs for purification or oxygenation. After that, it will be coming back. The blood which is being present in the lungs will be coming back to the left atrium and to the left ventricle, from where there it will be pumped to the entire body. The entire body will be receiving blood from the left ventricle. The left atrium will be receiving blood from the pulmonary structure, that is from the lungs, after getting purified. So the right side is concerned with the deoxygenated blood and the left side is concerned with the oxygenated blood. This is simply to concise and tell you so that you will be able to remember this as a quick shot. And we will be dealing with the other chambers and other structures inside the heart in the upcoming lecture series. Until then, thank you.